If you've been recently diagnosed with gum disease, it's critical to understand what steps you can take at home to stop bleeding gums and protect your teeth. Hi everyone, my name is Sammy. I'm gonna go over step by step some of the techniques that will help you master your gum care routine. And a special thank you to our sponsor, Ollie, who makes some amazing oral hygiene products that we're gonna talk about later in this video. Let's start with the people that are concerned about their gums but haven't seen the dentist yet. First step is to go to your local dentist and get properly diagnosed. They are going to look at your x-rays, your teeth, and the bones surrounding your teeth. The bone is what holds the teeth into place. And if you're losing bone around your teeth, then eventually your teeth become mobile. This can happen if there's a lot of plaque and tartar and buildup, and you haven't had a good cleaning in a long time, and you lose bone. So we definitely want to identify the severity of the gum disease, and x-rays help us do that. But there's also a lot of other tests that we do. Pocket measurements help us also determine how much bone loss is around your teeth.
This tool has marks that help us diagnose gum disease. Low numbers like 2s and 3s are a sign of good gum health. High numbers like 5s and 6s means you have bone loss.
We check to see if there's any bleeding when we're using these instruments. Healthy gums should have a nice stippling appearance to it. They shouldn't look red or inflamed. And essentially, we use all of these tools and instruments to formulate a treatment plan to get your gums back to health. Sometimes it's as simple as coming every 6 months for a regular or routine cleaning. Sometimes it requires something called a scaling and root planing. And sometimes it requires us sending you out to a periodontist, a gum specialist, and hopefully be able to save as many of your teeth as possible. Switching to a sonic toothbrush can be a great way to start your new brushing habits and do a better job of cleaning plaque off your teeth. Ollie Smart Clean comes with that X-Clean head, which is great for swollen and sensitive gums. Now, if you've been diagnosed with gum disease, one of the more common procedures that your dentist might recommend to you is something called a deep cleaning, also known as scaling and root planing. This is a very common, safe dental procedure done over 2 appointments, 2 hours each appointment, one side each time you come in. And essentially what your hygienist will do during the deep cleaning appointment is get you comfortably numbed up so that you're not feeling anything during the appointment, and then use a variety of instruments to scale off all that mineralized deposit, also known as calculus, also known as tartar, that gets stuck to your teeth under the gums.
This is how the dentist cleans your teeth. Special tools like this ultrasonic scaler vibrate and help remove buildup from your teeth. Hand scalers come in different shapes and have unique angles to reach different teeth. Let's test some out.
It is one of those procedures that takes a little bit longer and definitely takes some time to heal after getting it done, but it is really important to help stop the gum disease from progressing anymore. If you're about to have this procedure done, I would definitely recommend bringing some headphones in with you, communicating with your hygienist or dentist who's doing the deep cleaning, letting them know if you're feeling uncomfortable, if you need extra medicine, because that medicine is there to make it comfortable for you. Now, during the end of the appointment, after your teeth are completely free of debris and calculus, your dentist or hygienist may take an additional x-ray to make sure that all that debris is gone and that your gums are on the road to recovery. It will also place chlorhexidine, an antibacterial agent, in the socket to help promote healing and kill any residual bacteria that may be remaining. Also, depending on the severity of the gum disease, some offices use an antibiotic that go under the gums that can help promote healing. And some offices use a soft tissue laser to help reduce the bacterial load to as low as possible and get you healthy again.
Don't try this at home.
So you may think that after this procedure is done, that you're healthy, you don't need to be worrying about brushing and flossing as much anymore, that the dentist treated you and you're just doing fine, right? No. This is where the real work begins. Your at-home care is what is truly going to make the biggest difference and keep your gums healthy years after this procedure is completed. So what's the trick? What should you be using at home in order to take excellent care of your teeth? I would definitely recommend getting a sonic electric toothbrush. And a special thank you to Ollie, the sponsor of today's video. They make an amazing electric toothbrush that I'm going to be using to show you how to clean your teeth the right way. Toothbrush you choose is very important, and you want to be choosing a toothbrush that has very soft bristles, that is non-abrasive and gentle to your teeth. And when you're cleaning your teeth, the bristles are meant to be directed at a 45-degree angle between your gums and your teeth. Whenever I'm brushing my teeth, I always start at the gum line because that is one of those critical areas where If you have plaque and debris left behind, calculus can develop and it can eventually lead to bone loss around your teeth. Of course, it's very important to tackle all sides of the teeth. You want to get the occlusal or top portion of the teeth because your teeth have these natural grooves and valleys where food can get stuck. And if that food gets stuck and it doesn't get removed, it can turn into dental decay, which is basically an acidic biofilm that eats away at the tooth structure and eventually causes pain if it gets in close proximity to your nerve. Just like we're brushing between the gum and the teeth in the front side of your mouth, you also want to get the inside or palatal portion of your teeth. Now, I know it's pretty simple for me to do this on a model instead of in your mouth, but my goal is to show you the angles that I want you to think about when attacking those difficult to reach areas. In the mouth, it's a little bit harder because you have your cheek, your tongue, your palate, just the position of the brush may be hard to get in those hard to reach areas, but I would definitely encourage you to take your time when you're brushing. Think about angling the brush in the right orientation and think about what is the goal of what you're doing when you're brushing. Gum recession, or areas where there's a tight gap between the teeth, can cause food impaction, where food gets stuck in between the teeth. You have to be able to either brush out that food or use a floss to clean out those areas. Also really important to be consistent. We want to be able to brush for 2 minutes in the morning and at night. The Brio electric toothbrush also has a built-in timer. It helps make sure that you're not brushing too fast and you're taking your time to clean all surfaces of your teeth. So now I want to go off script a little bit and talk about toothpaste for a second. Toothpaste that you use is more important than you might think. There are a variety of different toothpastes on the market, and some of them are very good for you and some of them are very bad for you. Try to stick to a toothpaste that is not too abrasive. If you're using an abrasive toothpaste too much, it can be damaging to your gums and teeth. Some of the ingredients, like potassium nitrate, help to desensitize your teeth. This is really good for people that have generally sensitive teeth, where they may already have wear on their teeth, gastroesophageal reflux. Other habits, like eating a lot of acidic foods, that can wear down your teeth over time. Another ingredient that can be controversial is fluoride. I definitely understand if some people don't want fluoride in their toothpaste, but you should know that fluoride helps remineralize your teeth, it helps prevent cavity formation, and it has helped a lot of my patients that do suffer from rampant decay, where all of their teeth are decayed, or people that have genetic conditions that predispose their teeth to being more vulnerable to having cavities, or people that have radiation therapy to the head and neck, where their salivary glands are affected, and they're also more prone to getting cavities. Typically, your dentist will recommend a higher fluoride concentration to help those people out and get them healthier. And one of the relatively newer ingredients found in toothpaste is hydroxyapatite, which in its natural form makes up about 97% of your enamel, the outermost layer of your tooth. Hydroxyapatite also helps remineralize your teeth, which is great for people that are more cavity prone, and it's definitely another ingredient that is making a wave in the dental industry. I don't want to get stuck on this topic of toothpaste, but I'll try to include some articles down below in the description that go over the benefits of hydroxyapatite and some of the other ingredients I talked about today. And I would definitely encourage you guys to check out the Ollie toothpaste. They have a lot of these amazing ingredients that we just talked about earlier, like the sodium fluoride, like the potassium nitrate, and a lot of other amazing ingredients. Currently, it's my daily driver, and it's something I definitely recommend for you guys to check out. For those of you that are concerned about their gum disease, just remember that with a little bit of time and effort, going to your dentist, getting diagnosed, getting the appropriate treatments done, and then amazing at-home care using a sonic electric toothbrush, using the right toothpaste like the Ollie toothpaste, you're gonna get there. You can hopefully have an amazing 2024 with healthy teeth. Thank you so much for watching this video, and I'll see you for the next one.